Thank you. So I'm coming from the perspective in terms of what role can business play in supporting public health and wellbeing. So for those of you who don't know who Business in the Community are, we're the oldest and largest business-led membership organisation dedicated to responsible business. So I think it's fair to say wellbeing has already been established as a key strand of responsible business and has been absolutely central to what Business in the Community has been doing for many years. So wellbeing is absolutely firmly established as a key strand of responsible business. And businesses haven't waited for government to tell them to put wellbeing at the heart of what they do. They've gone and done it anyway because it's the right thing to do and makes good business sense. So at the heart of what Business in the Community does is our responsible business map. It's our kind of Bible, it's central to what we're about, and it's aligned to the United Nations Sustainable Business Goals, which obviously include health and wellbeing. So we have a responsible business tracker, which is a measurement tool for businesses to track their progress against the responsible business map. And the 2019-2020 Responsible Business Tracker Insights report summarizes the key findings and best practice examples for the last tracker cycle and what that could mean in the context of the COVID-19 pandemic. So the findings show that now, more than ever, being a responsible business really matters. The support companies offer to their employees, communities, and the most vulnerable during the pandemic speaks volumes. We believe that those who act responsibly now will be best prepared to handle what emerges on the other side of the crisis. It's also becoming clear that how issues are prioritised now will shape the new world. So even before COVID, we've seen that basically through the tracker assessment cycle, that what health and well-being actually continues to be the most material issue for companies. So again, we've heard a lot about COVID acting as a catalyst for what was already latent demand that was already there. So in terms of thinking about actually creating an impactful wellbeing strategy is very much relies on taking a proactive, whole person, whole organisation approach to embedding wellbeing into organisational culture. So at Business in the Community, our Work Well model has been central to our campaigning on health and wellbeing for the past decade. So the model provides an evidence-based framework for taking a proactive whole person, whole system integrated approach to embedding health and wellbeing into organisational culture. And that in turn will result in thriving people, thriving business and thriving communities. So organisational wellbeing starts with leadership, and the model promotes physical and mental health and wellbeing as strategic boardroom issues aligned to achieving long-term sustainability. So many of our members, including companies like Anglian Water, Costain, Unipart, Santander, National Grid, and Heathrow, support the well-being of their employees by taking this holistic, integrated and inclusive approach to ensuring that everyone's physical, mental, social and financial health is the best it can be. They recognise that their ability to perform successfully as businesses is entirely linked to the performance of their people. They all have a fundamental belief that looking after the well-being of their people is the right thing to do, and it makes them more successful commercially. They know that if people are at their best, then their business is at its best. And the evidence is growing that improving well-being not only helps reduce the cost of ill health, but also boosts engaged and healthy people, productivity, customer satisfaction and sales, increased stakeholder value, connected communities and sustainable business. There is a worry that as we move on from the worst of the pandemic, some people will see well-being as a luxury for the good times, something that can be deprioritized when the going gets tough. We know through the experience of the financial crisis a decade ago that the opposite is true. So far-sighted companies maintained and even increased their investment in well-being because they saw that the business benefits would be essential if they were to prosper in the recovery period. And the same is being seen during the pandemic. So many companies have increased their focus on well-being, and they are the ones that are likely to do well through the months and years to come. So momentum is growing in this area, and what we have seen is a diffusion of good practice as execs and non-execs have moved around companies. So far, it's mainly large companies that have embraced this agenda, and the challenge is to penetrate the SME market. So we know smaller companies can't generate the data to show a return on investment for what they might do, and because that's not the way they operate. We have to focus on the narrative of what good work and good management looks like and keep any interventions as affordable as possible. We know that creating good work is part of the solution in terms of tackling the systemic root causes of poor mental health, and conversely, creating good work that enhances physical and mental health. So employers can do more to relieve that pressure by taking ownership of creating good work that enhances good work for everyone. We know large companies can and do cascade good practice through their supply chains, and this has worked particularly well in some sectors like construction, where suppliers are largely local. But we know it's harder in other sectors where supply chains are global and often remote. So lastly is, so what do businesses need from government to support public health and well-being? So why is it that company-funded health and well-being services are often classed as taxable benefits when they're actually saving the NHS money and boosting productivity for the economy? Why is it that millions of people working as contractors or freelancers are denied access to even basic support services like company EAPs because of fears they will fall foul of IR35? Setting aside the moralities, does the potential gain in national insurance contributions really outweigh the cost of avoidable ill health to the NHS, the DWP and social services? In this country, we have world-beating companies that are trailblazers for putting well-being at the heart of what they do. We should be celebrating them and removing the barriers that prevent other UK companies from joining the movement. Also, with a small amount of investment, the government should update the HSE management standards and bring them up to date. There could also be the opportunity to relaunch them with a new national standard for psychological health and safety in the workplace, as a set of voluntary guidelines in promoting mental health and preventing psychological harm at work, as pioneered by Canada. They would send out a really strong message that physical and mental health need to be positioned on a parity of esteem. We know what gets measured gets managed, and we know that there's a strong interest from the investment community in public disclosure for both leading and lagging wellbeing indicators that are indicative of future performance. And one of the enhanced standards from the Stevenson Pharma Review, Thriving at Work, outlines a series of enhanced standards for employers who can and should do more to lead the way. The report recommends that these employers should increase transparency and accountability through internal and external reporting. And also in terms of attracting the best talent, we know that 80% of young people would trade their salary to work for a company that prioritises well-being. So in summary, in the UK, I think we've reached a tipping point for well-being that has the potential to really take off if we're bullish about accelerating this agenda. The implications of doing nothing will result in going out of business, and we need to do more to celebrate the world-beating initiatives of many UK companies. We need to move faster and further if more people knew about good practice and spread the message.
Thank you, Louise. That's